Hello, my name's Caroline Treble. I'm currently studying for a Masters in Counselling at Bangor University, and I'm here to present my dissertation to you. My dissertation is on the impact of self-care on levels of wellbeing and self-awareness in student counsellors. Self-care is well researched, and the results are pretty unanimous, showing that self-care impacts on self-awareness and wellbeing positively. Most of this research concentrates on those already working within the caring professions such as nurses, doctors or social workers. There is scant research regarding the impact of these practices on the student counsellor. Yet the student counsellor will experience stressors that are unique to them and which put them under enormous pressure. Pressure to perform under scrutiny, to cope with criticism, to cope with academic pressures, but also to cope with the soul searching that a course such as this demands. As students, we must open ourselves to others' pain, and in order to work effectively, learn to recognise and navigate the vast array of emotions and reactions that this will inevitably trigger within us. Similarly, within the student-tutor relationship, researchers suggest that transference and counter-transference can be a strong component within these relationships, and students must learn to understand this relationship dynamic and use this effectively within the therapeutic relationship. What is self-care? This is described by the BACP as a process that involves learning to care for yourself by participating in activities that help to maintain and heal our emotional, spiritual and physical well-being. In examining what self-care is, we find that it can often be separated into domains. The first domain, self-care that encourages traits such as resilience, high self-esteem and optimism. And the second domain, self-care that encourages engagement with others, positive relationships and practicing mindfulness. It has been shown to prevent vicarious trauma and compassion fatigue. Because of this, the BACP also suggests that as counsellors, we have a moral obligation to our clients to ensure that we work without risk. Moving on to self-awareness. Self-awareness is said to consist of two component parts too. First, the internal self-awareness. This involves how we view ourselves and has been found to predict better life satisfaction. And then we have external self-awareness, which consists of our awareness of how others view us. This can influence the quality of the relationships that we experience. These separate parts of self-awareness are integral to the way that we experience well-being. Simply put, well-being could be described as a state of being comfortable or happy. It's a state that we all aspire to. So how do we measure well-being? For this study, we use the PERMA profiler. This was first developed by Seligman in 2011 in his book Flourish. In this book, he split well-being into 5 domains: positive emotion, engagement, relationships, meaning, and accomplishments. In 2016, Butler and Kern designed the PERMA profiler, and to this they added negative emotion, loneliness, and health. So, we've discussed what self-care is, what self-awareness is, and what well-being is, and how it's measured. We've also discussed why this is interesting in terms of the student counsellor. So what are the effects of not attending to our own mental health? Maslach in 2017 suggests that one of these is emotional exhaustion. Even the most experienced of counsellors are affected by this. And chronic exposure to client suffering demands a certain amount of resilience that the student at this point has usually not had the opportunity to develop. Another problem that's associated with lack of self-care can be depersonalisation, feelings of hostility towards either clients or the job, and can be a result of lack of good supervision. Afjas van Dumenbeek's 2020 found that an elevated level of vicarious trauma was experienced by younger counsellors, and so they advocated strongly for the need for personal and supervisory support when dealing with a client's trauma. They advocate the need for supervision and support both professionally and personally. This will inevitably lead to a decreased sense of accomplishment, one of Seligman's domains within the PERMA profiler. So our method. Our hypothesis was that those who practice self-care routinely will experience higher levels of well-being and therefore less vicarious trauma or burnout. Well-being, as has been discussed, was measured by the PERMA. This consisted of 23 questions on a 10-point Likert scale, which measured all of the 8 domains. There were 3 questions for 7 domains and only 2 for health. Mean scores of each domain were found as is prescribed by Butler and Kern. Unfortunately, due to a computer error or human error, we had missing data and had to remove some of these sets, leaving us with only meaning, relationships, loneliness and negative emotions from the domains that were specified. Self-awareness was measured using Sutton's 2016 Self-Awareness Outcomes Questionnaire, the SAOQ. These questions were also separated into domains of acceptance of self, proactive at work, emotional costs, and reflective self-development. Again, the mean score for each of these subsets was found, as well as the mean score for all of the questions together. Self-care, measured using a questionnaire devised by the authors, of which I was one of them, and here I must give credit to the group that I was with prior to this year, as they were instrumental in forming these questionnaires. So these were a 23-item, 5-point Likert scale questionnaire for self-care. Psychological habits, also measured by a questionnaire designed by the authors, denoted spontaneous, guided or scheduled practice, spontaneous being less desirable than scheduled. So this study was a cross-sectional study, meaning that a certain sample of participants were taken at a certain time, rather than a longitudinal study which would follow said group of participants over a longer period of time. A Pearson's correlation was then run to try to find links between the 4 dependent variables: self-awareness, well-being, self-care, and psychological habits. Our findings were surprising. They refuted our hypothesis that high levels of self-care would result in high levels of well-being. We found no correlation between self-care and well-being, no correlation between self-care and self-awareness, no correlation between psychological habits and either well-being or self-awareness. However, there was a positive relationship found between self-awareness and the domains of in well-being of meaning, loneliness, and relationships. Here we can see that well-being and meaning in life and self-awareness correlate positively, quite significantly, at a level of 0.01. Loneliness showed a positive correlation at the 0.05 level, and self-awareness and relationships showed a positive correlation at 0.05 level. So the results totally refute most of the research done previously, although what we did find was that self-awareness was already fairly high amongst this group, whereas self-care and psychological habits and their practice were relatively low. I think psychological habits were 2.9 out of a possible 6. So what does this mean? the literature available refutes our findings, and why were our results so different to current research? Our data came mainly from Bangor University, and we know this because of the email addresses provided, also because the target groups were from within the North Wales area. The mean age of our respondents was 36. This suggests that most of the participants live within the area. Therefore, they already have a family or a social network. 60% of the population in Britain are married between the age of 35 to 39. And UCAS data states that 80% of mature students choose to live at home when studying, with some travelling up to 70 minutes or more daily. We can then surmise that the majority of students already self-care in regard to psychosocial aspects, spending time with family and friends, and would therefore not include this aspect, as this is already a part of their daily life. It would not be considered a scheduled routine, but a spontaneous one, and that would impact on our results for psychological habits. If you remember that previously we'd already said that spontaneous was deemed to be less desirable than scheduled. Another factor that may have influenced our data is that most of the respondents were studying at master's level, and Rest in 1994 found in his longitudinal study that self-awareness increased according to how highly we're educated. What is interesting is that working within the caring professions in his study showed little impact on the results. So doctors actually scored less than lawyers in levels of self-awareness. Another aspect that may have influenced the data is that the criteria for entry onto this course is stringent. Faye repeatedly assures us that should she believe we are not able, then we would not have been accepted onto the course. This is perhaps a result of past lessons learned. Bermack, Epp and Keyes in 1999 explored the issue of student counsellors being academically able and yet often finding limits in their mental health and suffering from the inherent problems that this involves. So, limitations of our study. One of these could have been sample size. Our sample size was small with only 35 participants. This could affect the interaction between variables, which may be missed or compromised. And another potential problem with small sample sizes could be outliers. Within a larger study, the results of the influence of outliers would have been much more diluted. Another issue could be selection bias. Selection bias is something that is known to affect quantitative research quite profoundly. Research shows that counsellors are reticent when admitting to any mental health issues. The subject of self-care is sometimes difficult to explore within counsellors and mental health professionals, as therapists don't like to admit that they are struggling. Baker and Gabriel's study examining how therapists integrate into self-care into their lives during periods of personal distress found that counsellors feel stigmatised or fear that they will be exposed as unable to function should they seek help. Their qualitative study found that half of 40 therapists interviewed felt they were underachieving and suffering from depression, and yet they all continued to practice. Another factor that may have influenced our data would be that students who were not experiencing high levels of well-being would not want to participate due to concerns of being triggered. So what we found was that self-care was poorly utilised within this group of students. Self-awareness and well-being levels were relatively high, and that a correlation was found between self-awareness and some well-being subgroups. Research suggests that self-care becomes more necessary to positive mental health as careers in counselling progress. And although this study refuted the majority of the research currently available, we have exposed or explored possible reasons for this. and know that as our careers progress, good psychological habits are likely to become the bedrock of our coping strategies for preventing vicarious trauma and increasing well-being and therefore resilience. So the take-home message would be: look after yourselves, take care of yourselves, and develop that resilience, because we're going to need it.